We see it on the news quite often. Police engaged with a mentally challenged person.
Oftentimes when law enforcement come in contact with the folks we serve, there are really two options. It's either they're taking folks to the emergency departments or they're taking them to jail.
Can you just talk to me and drop the knife? And sometimes it's an encounter that ends deadly. Meet Eric Doa. He's the president and CEO of Detroit Wayne Integrated Health Network, leading this organization as it provides integrated behavioral health services for residents of Detroit and Wayne County.
With all due respect to the fine doctors and others in the emergency setting, the emergency room is not equipped to handle folks who are going through a mental health crisis.
And neither is a jail, he says, due to the ongoing care that's needed. That is why he is excited about the transformation underway of a new clinical care center. The Detroit Wayne Integrated Health Network is redeveloping a facility in the Milwaukee Junction neighborhood, a space that will give the organization expanded capacity to provide centralized wraparound care for people struggling with addiction and mental health.
You're talking about a place that folks will now be able, to go to receive crisis services. And, that is so important to have within Wayne County with a population of close to about 1.7 million people. We should have 3 crisis centers. And to be able to provide that in the community is going to be so significant. You're talking about approximately 40 beds, spaces, bed spaces for children as well. And if you paid any attention to news within healthcare, you've definitely, have heard about the limits that have been placed on just resources and the disparity that exists. So to have something like this in Wayne County is going to be so huge and significant.
We're talking a new $12 million center where someone can stay until they've reached a point of stability, a place that will be a resource that links the individual with additional wraparound and social services within this provider network.
We are not, of the business where someone stays and for a short time period, they're gone and that's it.
The Crisis Care Center also hopes to create some efficiency, easing the time and resources for police departments dealing with individuals suffering from a behavioral or mental health situation.
You'll be able to get to the door, drop that individual off, and you as a patrol officer, you go on your way. And that is so important because you don't want to have something like this where officers are there for hours on end trying to figure out, okay, what do I do?
An integrated care campus is also planned for 7 Mile and Southfield. These type of investments and forward progress takes leadership and also teamwork.
Sometimes it's so easy for us to sit within these offices and talk about the changes that we can make, but what are we doing at ground level? What are some of the places that you've been to see what's happening at ground level? And I think it's so important that we continue to play a significant role in our communities. But I tell you, I am proud of the men and women in this organization, the provider network. It takes a lot, to put the needs of others before yourself.
And that's something Eric and his team does each and every day. In Detroit, Andre Ash, Michigan Chronicle.